Do you know your enemy? When fighting a war, it is necessary to learn all you possibly can about the enemy. If nothing is known about an enemy, the chance of winning a war will be significantly diminished. The coronavirus, SARS-CoV-2, which is Severe Acute Respiratory Syndrome, Coronavirus 2, also referred to as COVID-19, is the enemy, and it must be defeated. We must all understand what a virus is, and then we can work together to defeat it. The first characteristic of a virus, which must be understood, is that it is not a living thing. A virus cannot reproduce itself. It propagates when it enters cells within living organisms, where the duplication mechanism within living cells reproduce the viral nucleic acid code. A virus particle does not have the ability to think, so it cannot plan to inflict damage upon the unwilling host, and it has no survival instinct or desire to multiply and propagate itself. A virus particle is composed of a DNA or RNA molecule surrounded by some protein molecules. They are so small that an optical microscope cannot see them. An electron microscope is needed to produce an image of a virus. There are many different viruses, and most will not cause a problem, but some have a protein configuration which unlocks the cellular door, and this allows the virus to enter the cell. The DNA or RNA code of the virus is then copied and more particles are produced. Think of it as a copy-paste operation of an executable file on your computer. The host immune system will detect this abnormal process, and an immune response will be initiated to fight the infection. Several factors influence the progression of symptoms and the clinical outcome of the infected hosts. The defensive process begins with increased production of antibody-secreting cells, T cells, and other factors, as the host's immune system prepares for the ensuing battle. The immune response is not instantaneous. Once an invading virus or organism is detected, some length of time is required for the production of antibodies to ramp up. If the host's immune system is compromised or suppressed, and the viral invasion gains the advantage, recovery may not be possible. Because virus particles are not living organisms, treatment with antibiotics will not be effective. In some cases, a secondary bacterial infection will develop in the host, and this can be treated with antibiotic therapy if indicated. Vaccines can be developed for known viral threats to activate a host's immune system prior to a possible infection. This can be effective as a preventive measure in some instances, but is not 100% effective and is not a useful treatment for an ongoing viral infection. Some antiviral drugs have been developed, but these are also not 100% effective. Prevention is obviously the best available approach in dealing with these threats, by isolating sources of viruses that could infect a human host. If this had been done when the SARS-CoV-2 virus was first discovered, the consequences which have touched the lives of everyone on planet Earth could have been avoided. Now we must all work to defeat the invading viruses that threaten humanity. Be aware that infection occurs by inhalation of airborne droplets from coughing and sneezing. Apply common sense countermeasures to control and reduce this source of infection. Be careful to not touch your eyes, nose, or mouth with unwashed hands. Washing with soap and water releases viral particles from the skin and flushes them down the drain. Virus particles on surfaces can remain viable from hours to several days. A sodium hypochlorite unscented household bleach solution will destroy viral and bacterial invaders. Add 1/3 cup of bleach to a gallon of water, or if using metric units, 80 milliliters bleach to 3.8 liters of water. Ventilate the area while using the bleach solution and wear gloves. Keep the surface wet for 10 minutes before wiping it dry. Do not forget what you have learned from this unpleasant situation which we must all deal with. Maintain your awareness even after the war has been won, and continue to fight these submicroscopic invaders. New threats from unknown viruses and mutations are a very real possibility. Constant vigilance and the application of effective countermeasures is essential. Be aware that testing for the SARS-CoV-2 virus is not perfect. False negative and false positive results are possible, as with any test. Test results can vary depending on when a test is administered. An individual could be infected and asymptomatic early in the progression of disease, and a test may not detect the virus. As on-site testing becomes available, which detects antibodies to the virus instead of detecting the viral RNA, it is important to know that if tested before the host immune system has produced antibodies, the test result could be negative. A positive antibody test indicates that a host has been exposed to the virus, and these antibodies will persist in the blood after the virus has been eliminated by the host's immune system. As we have seen from the mortality data, the SARS-CoV-2 virus is very difficult to defeat in individuals with compromised immune systems, pre-existing conditions, and nursing homes. We must prioritize healthcare that is focused on prevention and reward individuals who make responsible lifestyle choices to optimize their immunity to viral threats. Foods and other substances that negatively impact immune function must be replaced by better choices. This will also address the burden imposed on the healthcare system by type 2 diabetes and other conditions which are costing society huge dollar amounts each and every year. The cost of fighting a global pandemic cannot be tolerated again. If a mutant or unknown virus, which is as contagious as SARS-CoV-2 and as deadly as Ebola, were to be unleashed on humanity, we would be powerless to fight it, and the entire population of Earth could even cease to exist. We must plan for this possibility now. Any delay could be too late. Never underestimate the enemy. Stay safe and learn new things. Best of luck to everyone on planet Earth.